Hello everyone. Today I'm going to talk to you about the anatomy of the neck, and this is a brief outline to the things I'm going to talk to you about it during the video. Drawing of the triangular of the neck. After that we'll focus on the muscle of the neck. Then we will discuss the triangular subdivision and their content. And this is the drawing. I will explain how to draw this line, and also I bought a picture of the right side of the neck, so it will make it clear to imagine. So I need from you now to copy what I am doing. This is the side of the neck, rectangular shape. Posteriorly we have anterior border of the trapezius. Inferiorly we have the inferior border of the mandible and the imaginary line from the angle of the mandible to the mastoid process. Anterior we have the middle line of the neck, which is imaginary line from the symphysis menti notch to the suprasternal notch. And posterior we have the clavicle bone. Then we will divide the rectangular to the anterior triangular and posterior triangular by the sternocleidomastoid muscle. So we have inferior belly of omohyoid bone, superior belly of omohyoid bone, posterior belly of the gastric muscle, anterior belly of the gastric muscle. Then we will have the hyoid bone. Let's move to our second object, which is the muscle of the neck. Okay, the sternocleidomastoid muscle. It is arising from the sternal head from upper part of the anterior surface of the membrane of the sternum, and the clavicle, which is upper surface of the medial 1/3 of the clavicle, and inserted into the mastoid process lateral 1/3 of the superior nostril line. And the nerve supply of this muscle: motor we have a spinal accessory nerve, sensory we have C2 and C3 proprioceptor. Action of this muscle: if it is acting alone, tilt the head to the same side and turn the face to the opposite side. Also, if the neck is fixed, elevated the ribs and forced aspiration. The next muscle we have the gastric muscle, which is consists of two belly, anterior belly and posterior belly. The anterior belly, it is arising from lower border of the mandible near to the midline and producing a smooth depression on each side called the gastric fossa. The posterior belly is arising from the narrow notch on the medial aspect of the mastoid process called the mastoid or the gastric notch, and inserted to intermediate tendon held down to superior border of the hyoid bone by the fibrous poly derivative from cervical fascia. And the action of this muscle: it is allowed the hyoid bone to move backward and forward when it is elevated by the gastric and depressed the mandible. The second muscle, it is a omohyoid muscle. We have the superior belly and inferior belly. The superior belly, it is lateral to the sternohyoid and run downward and laterally, passing deep to sternomastoid. The inferior belly, it is passed in the posterior triangular to reach the scapula. And these two belly are joined by flat tendon deep to the sternomastoid. So let's move to discuss that triangular. We have posterior and anterior. I will start with the posterior triangular. The boundaries of this triangular: anterior we have sternocleidomastoid muscles, posterior we have trapezius muscles, inferior we have the clavicle, and the apex of this triangle formed by the occipital bone over here. The roof of the posterior triangular is formed by the skin, superficial fascia, platysma muscles. Platysma muscle, it is can be seen as a sheet of muscles by asking the patient to clench his jaw firmly, and the muscle extended from the body of the mandible downward over the clavicle into the anterior thoracic wall. As you can see here in the picture, the floor of the triangular is formed by the following muscle from above to downward. As you can see here in the picture is more clear. Okay, let's talk about the subdivision of the posterior triangular. The posterior triangular is further divided into two smaller triangular by the inferior belly of omohyoid muscle to supraclavicular triangle, and also as you can see here the occipital is bigger than supraclavicular. The supraclavicular triangular is formed anterior by the sternocleidomastoid muscles, posterior by the inferior belly of omohyoid, inferior by the clavicle. The occipital triangular is formed by the sternocleidomastoid muscle anterior and posterior by the trapezius muscles, inferior by the inferior belly of omohyoid. Let's talk about the content of the posterior triangular. We have nerve and plexus. We have spinal accessory nerve, which consists of branches of cervical plexus, a greater auricular nerve, transverse nerve, laser occipital nerve, and supraclavicular nerve. Here we have the clinical significance of the posterior triangular. The accessory nerve may get damaged while taking lymph node biopsy. Also here we have roots and trunks of branchial plexus. Regarding the vessels, we have subclavian artery and vein, we have a transverse cervical artery, we have suprascapular artery, and also we have external jugular vein. And also here we have clinical significance regarding the external jugular vein, because it is present in the superficial location here, and this is make it easy to get injury. Also we have a lymph node, we have occipital and supraclavicular, and we have muscle, of course, the inferior belly of omohyoid muscle. Let's move to the anterior triangular. The boundaries of the anterior, posterior we have anterior border of the sternocleidomastoid muscles. Anterior we have the midline of the neck, which is imaginary line extended from the symphysis menti to the suprasternal notch. Superior we have inferior border of the mandible and line extended from the angle of the mandible to the mastoid process. The anterior triangular is divided into 4 smaller triangular. We have submandibular triangular or digastric triangular. Also we have submental, carotid, and muscular triangular. So let's get started with the submandibular triangular. It's formed anteriorly we have anterior belly of the gastric muscle, posteriorly we have posterior belly of the gastric muscle, and superior we have inferior border of the mandible and the imaginary line. The content of this muscle, we have submandibular gland, we have facial artery, we have hypoglossal nerve, facial vein, submandibular lymph node, and parotid gland. So this is the 6 content. You need to memorize it for the submandibular triangular. The next subdivision, we have submental triangular, which is formed by the anterior by the midline of the neck, the imaginary line from the symphysis menti to the hyoid bone, and posterior we have anterior belly of the gastric muscles, inferior we have hyoid bone. The content, we have submental lymph node and anterior jugular vein. The next subdivision is muscular triangular, formed by anterior by the midline of the neck, which is the imaginary line from the hyoid bone extend to the suprasternal notch, and superior we have superior belly of omohyoid, inferior we have inferior border of the sternocleidomastoid muscles. The content of this muscle, we have infrahyoid muscle, which consists of the sternohyoid, sternothyroid, thyrohyoid, and omohyoid. The last triangular we have, which is the carotid triangular, formed inferior by the superior belly of omohyoid muscle. Laterally we have a sternocleidomastoid muscle, and superior by the posterior belly of the gastric muscle. The content of carotid triangular, we have a carotid sheath, which consists of common carotid artery, internal and external carotid artery. We have internal jugular vein, we have vagus nerve, ansa cervical, and also we have deep cervical lymph node. By this we finish the triangular of the neck. We explain posterior triangular and anterior triangular. Also we discuss the subdivision for each triangular and their content. Last thing to mention here regarding the triangular, we have 2, 1 for each side of the neck, right and left, except for the submental, which is a single triangular. If you can see here in the figure, it is 1 in the middle, and this is my references. We hope this video beneficial. If you have any question or comments, feel free to contact us through email.